All right, this is part 2 of our infections of the circulatory and lymphatic systems for microbiology. We're going to be looking at these viral infections here. The first one we have is mononucleosis caused by Epstein-Barr virus, which is actually a herpes virus. It's herpes virus 4. And mono, as it's sort of called in short, is found in humans, and it's transmitted primarily through saliva, which gave it its nickname, the kissing disease. But also other body fluids are involved, primarily saliva, but also through sexual contact. And exposure to this is common. Epstein-Barr virus is very common. They say that almost all people have been exposed to it sometime in their childhood. And just like any other herpes viruses, it does remain dormant in your body. And so where it is basically the B cells. All right, so it presides in our B lymphocytes and can remain dormant for a very, very long time. So what infectious mononucleosis looks like is basically this low-grade infection that lasts a very long time. It's typically self-limiting, but you have sore throat, fever, fatigue, lymph node swelling, and sometimes you have spleen and liver enlargement. The main symptoms of this mono is just extreme fatigue. I actually knew my friend had mono in college, and she was just so tired all the time for, I think, 2 or 3 months. So it can continue for several months. And so that is basically mono. It's a low grade, very, very tired, several months, but then you can just get over it. If you are immunocompetent, complications are rare. Immunocompetent is just you have a great immune system, but in some patients you can have other complications from it. But usually a mild disease. Epstein-Barr virus can also cause something called Burkitt lymphoma. This is in patients particularly with malaria or HIV infection, and it can lead to a fast-knowing cancer. Okay, so it's the cancer of B cells, and they do cause solid tumors, and this cancer is a kind of lymphoma. So lymphoma is basically a B cell or T cell cancer because the lymphocytes, remember from class, they're either T cells or B cells. So in this case, it's our B cells. And it's more common in children. So it's also more common in Africa or anywhere where you have HIV infection, and malaria infection is very, very high. The tumors can grow very rapidly. There's very aggressive treatment for it, but at least there's a very good cure rate of 90%. The other form of mono is going to be caused by another virus called CMV, cytomegalovirus, and it's called a non-Epstein-Barr infectious mononucleosis, another herpes virus, so herpes virus number 5. Human reservoirs, many people have been infected with this virus, and contact with body fluids such as saliva or urine. Very commonly, sexual contact, nursing, causes exposure to this virus. Blood transfusions, and organ transplants. I do have a picture of a woman here because it does pass through the placenta and it can infect the fetus. So this is a different, the other mono did not do that. So this can infect the fetus. And they tend to be milder for the baby, but they can be very severe as well. It depends on when in pregnancy the virus crosses over and to infect the fetus. But the earlier, the worse, right? The earlier you have very important organ formation going on, and that can lead to very serious complications like blindness, growth retardation, and then the majority, and that's good news, it's very little symptoms, never have symptoms, or they never experience long-term problems. So it's just a very few of these will cause very grave problems for the baby. In adults, CMV is basically asymptomatic in a lot of people, and others will mimic mononucleosis. But in those that are immunocompromised, it can cause a lot of damage, liver damage. So you can see how it overlaps. If you're immunocompromised or if you're a fetus, it can go to the liver damage. It can cause tissue rejection and death. AIDS patients, we'll talk about later, who have a decimated immune system, can actually activate their CMV infections, because remember, this is a herpes virus. It stays in your bloodstream, or it stays in your body, and they can reactivate it. All right, our next topic for viruses is arboviruses transmitted by mosquitoes. Arboviruses, this is that term for any virus that is transmitted by a vector, especially by mosquitoes. And we're only going to talk about 3 of them. So we're going to talk about dengue and yellow fever, and then also dengue, yellow fever. Oh, that's it. Japanese influenza. Yeah, that's the 2. So yellow fever, the yellow comes from the flavivirus. This actually means yellow virus. However, it does turn you yellow because it's going to cause jaundice. So the transmission is going to be a mosquito bite. The mosquito most commonly responsible for urban areas. There's other mosquitoes that can transmit it, but is the Aedes aegypti. We're going to hear about this guy again. This Aedes aegypti is responsible for transmitting a lot of diseases. And it's a very particular kind of looking mosquito. And the illness for yellow fever can be anything from a self-limiting fever to severe jaundice with bleeding. So that jaundice is what gives it the name, right? You can see this patient here with very yellow eye whites. Petechial rash, this just means a rash that is sort of spotted. You can have hemorrhaging, and then so on and so forth, right? Confusion, apathy. And so basically people can get over this. Patients have a rapid recovery and no sequelae, so no long-term effects. There's no treatments available for yellow fever. For dengue fever, hey, look, we have the same mosquito, Aedes aegypti. Now we have a good look at it. This Aedes aegypti has a characteristic white dot pattern all over its body, on its legs and on its abdomen here. So that is the mosquito that we need to somehow curtail spreading infection. For dengue fever, it's going to be predominantly in your tropical regions. So if you travel to the tropics, this is something you need to think about. It's usually self-limiting. Okay, that's good. However, it can get really, really bad. So if you do have a worse form of this disease, you'll get a really, really high fever really fast. You'll have intense headaches, a rash, and then you'll start bleeding, nose bleeding or gum bleeding. And then the nickname for this is called breakbone fever, because this also causes your muscles to ache, and that it causes you to feel like your bones are breaking. In some patients, that dengue fever becomes hemorrhagic. So you're going to have more severe nose and gum bleeding. You're going to be vomiting blood. Black tarry stool indicates that you have bleeding in your intestines, and that's causing your stool to be black. And so it can also lead to the shock, dengue shock syndrome. So 30% of patients with severe hemorrhagic disease with poor supportive treatment have a really high mortality rate. But with nice treatment, you can get 1% mortality rate. So hopefully people with dengue fever have access to healthcare, but in these tropical regions, you do have areas of impoverished communities where they don't have access to healthcare. Our next virus here is going to be Ebola. Ebola virus causes a very awful disease. So the transmission is from the body fluids, any body fluid, blood, saliva, sweat, urine, feces, and it can get on contaminated fomites. It's very highly contagious. It is why people that are going into areas with Ebola have to wear basically all the PPE that they have, blocking their mucous membranes or any way of the virus getting in. And it's also a fact that people who walk in and treat the Ebola patients, some of them will get infected along with the patients because it's so contagious. There was an epidemic in 2014 in Africa where 28,000 people were in 10 countries were affected, and then you had 11,000 people dying from it. So Ebola is going to start off like a flu, and then you'll start hemorrhaging about 3 days in. And the hemorrhaging, of course, is just bleeding through the GI tract, the skin, and other sites. You have the loss of blood leading to coma, shock, multiple organ failure, and death. So the mortality rate is huge. The mortality rate is 15 to 90%. There's no effective treatments right now other than supportive care and then to keep people with Ebola isolated. One of the cool things about Ebola, or the only cool thing maybe, is that it has this really interesting shape to it. This is no other virus I can think of has this like candy cane shape to it. So this is, and also Ebola is one of the largest viruses around. It's a pretty big one. All right, moving on to HIV. So HIV is going to be a virus that infects specifically CD4 positive cells of our immune system. If you remember the immune system, helper cells were critical in activating all parts of our immune system. They help B cells, they help T cells. Without them, your immune system is decimated, which is what happens with untreated HIV infection. So it's direct contact with bodily fluids, mainly sexual contact and blood contact with sharing needles. Things like hugging, kissing, or any sort of milder form of transmission is not going to have enough virus to cause infection. So when you get infected, it can take years to detect it because during those years, the viral load is being kept at bay by your immune system. So it's not a latent, it's basically active. The viruses are continuously produced, and your immune system is fighting the entire time to clear the viral infection. And then over time, your immune system is going to lose because it's literally attacking the one cell that's responsible for the robust response of your immune system. So what happens over time is that your CD4 count gets very low and the virus load is going to increase. Normal CD4 count is going to be 1,200 cells per cubic millimeter. And if you look at the AIDS, which is the sort of terminal part of this infection, is 200 cells per microliter. So this is also microliter. Anyhow, so you're losing, a huge amount of your CD4 cells. So what does the first and second and third stage look like? Acute HIV infection is you're going to have a flu-like illness. And then you can have, with this part, 500 cells, so we're really decimated the CD4 count right off the bat in this acute infection. They have a lot of viruses in their blood, very contagious. Stage 2, and of course we do have antiretrovirals now that can attack, the replication of HIV. HIV is still around, but you have this latency period where the virus is at low levels, and you may not experience any symptoms. However, during this latency, the same thing that's going on in the first one, your immune system is still trying to fight the infection, but it's going to kill off your CD4 cells. And so your response to that infection is going to go down. The viral load is going to increase at the end, and then the CD4 count is going to decrease. And then you're going to start to see things like opportunistic infections start to come out. Stage 3 is when you have AIDS, which stands for acquired immunodeficiency syndrome. And the diagnostic criteria for AIDS is that your CD4 cell count drops below 200 cells per microliter, and then you begin to develop certain opportunistic diseases that are common between all AIDS patients, such as Kaposi sarcoma. That's a kind of cancer that you only see in devastated immune systems, which is here. Rare cancers such as Kaposi sarcoma. So it is a fatal progression. People with untreated HIV infection will die from some kind of opportunistic infection that they have. They also experience wasting and dementia. Right, so that's HIV. And so we want to look at this next slide here, which tells you, it's a graph of your CD4 count. So let's just take a look at that first. So here's your primary infection with a healthy CD4 level. And then after the primary infection, remember it's working really hard. Your CD4 levels are dropping. And then the viral load, the RNA line, is going to come up, right? So the viral load comes up, your immune system is down. All of a sudden your virus load comes way up, and this is where you have your symptoms. Acute HIV syndrome, all right? And then you have this latency period where the viral load, the red line, goes down. This just means it's a variable amount of time. Like, we don't know how much time. This is different for different people. But you can see the virus in this latency period from here to here will have an upward swing, right? So the virus is going to eventually overcome the immune system. Your CD4 count at the same time is going to go down. And then this is where you're going to get your opportunistic diseases occurring. After the latency period, you're going to have a huge increase in the viral load because your CD4 count is so decimated at this point. And so you're going to have death. So if you look at the CD4 count here at 200, if you reach 200 and under, this is your AIDS, right? So this classifies you as having AIDS. Luckily, we do have really good medicine for AIDS infections or HIV infections at this point, so people can live a long life as long as they take their medications as prescribed. So viruses, we didn't cover a lot of viruses, but we did cover HIV, Burkitt lymphoma, let's see, dengue fever, Ebola, and mono yellow fever. Okay, so those are all the viruses that we have. And now we're moving on to the protozoan infections. So they're two big ones. Malaria is a big one. So the protozoan is called an apicomplexan. So the apicomplexan, if you remember from lecture, is a specific type of protozoan that has an apical complex that attaches to your cells. The the genus is called Plasmodium, and there are several species in the Plasmodium genus. So you can see Plasmodium falciparum is the most malignant form of malaria. Like this is the most virulent form. Then we have Plasmodium malariae and Plasmodium vivax and Plasmodium ovale. So malaria is going to occur anywhere the Anopheles mosquito is. So the Anopheles mosquito is pictured down here. And so where this mosquito resides in Asia, South and Central America, it's a really big problem. And we'll look at the life cycle. There's a complicated life cycle that Plasmodium has. It has two hosts. It's, remember, the definitive host is where the parasite undergoes sexual reproduction. And for this malaria, the definitive host is our little friend here, the Anopheles mosquito. And the intermediate host is an organism that it does not reproduce in sexually, but it can asexually, and that's going to be humans. That's going to be us. All right, so let's look at the life cycle. So you do need to know the life cycle. So let's start with A, okay? So a mosquito bites you, and the mosquito has the form of the Plasmodium called sporozytes inside of its salivary glands. So see, the salivary glands of the mosquito contains those sporozytes. So sporozytes enter our body, and they have a tendency to go into the liver. So they attack the liver first. In the liver, they undergo something called schizogony, which is let me show you the picture. Schizogony is just multiple mitoses within a cell. And then you have this schizont, which is many, many, many forms of this Plasmodium that started off with one nucleus. Now you have several, plentiful nuclei. And then when it divides into numerous amounts of these Plasmodium. So the terminology here is going to change a little bit, right? So we're making merozoites. So let's go back to the picture. Remember, sporozoites came into the body. In the liver, they're undergoing schizogony. Let's put an H there. S-C-H. Let's put schizogony. And you're going to produce many, many copies of the merozoites. So now we have merozoites, and then you see that word here. The merozoites will exit the liver and enter the bloodstream, and it's the merozoites that infect your red blood cells. The red blood cells, when the merozoites infect them, they'll actually start to change again into another form called a trophozoite, and we've heard that word before. For the red blood cells are infected, the trophozoite will appear like a ring. It's sometimes when they look for, if you're infected with malaria, they'll just take a little blood smear and look for these ringed red blood cells. The form that's in the red blood cells, this ring shape, can do two things. It can form, basically mature and then form more merozoites. So you see how trophozoites can become more merozoites. And then some of these ring stage red blood cells may produce gametes. gametocytes. These gametocytes are just right alongside your red blood cells. It looks like sushi, doesn't it? But these guys, the male and female, are floating around in your bloodstream alongside of your red blood cells. So they're not actually inside the red blood cell anymore, they're outside. And that is if you have an uninfected mosquito. So this is a mosquito, no malaria inside. If it were to take a blood meal from you, the gametocytes can move into the gut. And now we have the definitive host. In the gut of the mosquito, we have our gametes that it just sucked up from the person. It's going to fuse, right, with form a zygote. So this is the sexual reproduction part. And then that zygote will then basically move to become sporozoites. Okay, so the sporozoites are going to be formed in the gut of the mosquito. Those sporozoites will then move into the salivary glands and sit here. And so when the mosquito bites another person, it can transmit those sporozoites. So the mosquito here is really key. So if the mosquitoes were not infected with malaria, then it's fine, right? The mosquito bite doesn't do anything. But the mosquito is infected with malaria, then it can start this whole process. So malaria is an issue. It's been a long time. It's always been a very, very big problem in most of the world. And most of the most severe cases and the people who die from malaria are children. And so it's been a problem for a very long time, and people have been working on drugs or vaccines against malaria for a long time. And good news is that they did come up with a couple vaccines that seem to be working. But before we look at that, let's just look at the blood smear here with our little gametocyte. Have no idea if that's a male or female, but there it is. So right alongside, kind of like on top of your blood cell, taking a ride. And then this is the ring stage, right? So this is that trophozoite inside your red blood cells. And while it's inside your red blood cells, you guys, it is eating hemoglobin. Hemoglobin, remember, is the protein that is going to carry oxygen around, hemoglobin. So it's eating your capacity to carry oxygen. And as it's eating your red blood cells hemoglobin, it's growing. It's either going to form your merozoites again, or it's going to form those gametophytes. And in order for those guys to come out, they need to lyse the red blood cell. So you have a red blood cell full of these plasmodium creatures. They have also created a lot of waste products, right? So while they're inside, they're eating, but they're also making waste. So upon lysis of these red blood cells, all of the waste comes out. And that is what's going to cause a spike in fever. So when you see malaria is hallmarked by it's basically a up and down of fever. You have a fever for a couple of days, it goes away, another fever in another couple of days, and it goes away, because it's following the sort of lysis of the red blood cells, the infection cycle of infecting red blood cells and then lysing red blood cells and then infecting them again and lysing them again. So you see the disease, right? Malaise, being tired, low oxygen, obviously, fatigue, aches, nausea, very high fever and chills, and intense sweating. And so the fever and chills and intense sweating, these are all related, and they occur in 48 to 72 hour intervals. And I just explained why, right? Because it follows the course of the red blood cell lysis. When you have the malignant form of malaria, what makes this more deadly is that it does kill more red blood cells than in other forms. And also it causes the red blood cells to develop these knobs that make them very sticky, and they can stick to the walls of capillaries. They can clog your blood vessels and cause tissue death. It can be in the kidney, it can be liver or brain damage. So because you're losing and you're lysing so many red blood cells, remember we talked about how our liver and spleen were the organs to clear the red blood cell parts, right? The fragments that are dead and dying. And these can become overwhelmed. So you can have organ enlargement here, as well as rupture. So your spleen can get so swollen that it can rupture. The spleen is actually very thin. There's a very thin sort of connective tissue on top of it. So it's actually one of those organs that's can be burst if you just were hit very hard in the spleen. Kidneys are indicated here because kidneys are filtering your blood. So if you have fragments of your blood cells floating around, they're going to get clogged in the kidney. So you think about the glomerulus and how it's a capillary network. And if you have these big fragments of cells coming in, it can clog those glomeruli and cause the kidneys to malfunction. So that is malaria, and the new vaccine was introduced very recently. There is one in 2021 and another one in 2023. The WHO just recommended them, and they're both intended for children because, again, those children are the ones that are most affected with the more virulent form and die from it. All right, so for toxoplasmosis, this is going to be caused by a protozoan called Toxoplasma gondii. And this is in our little cats. So the definitive host is our house cat. Intermediate hosts are mice, humans, cattle, and sheep. And they do say, right, experts say that the majority of the world's population at some point have been in contact with Toxoplasma gondii. And the way you get in, the way it's transmitted to you is by ingesting the cysts. So this Toxoplasma does form a cyst in the feces of cats. And so if you own a cat, be careful with that cat litter. Handling cat litter in the soil, maybe contaminated by feces, is going to be the predominant way that people get infected. If you don't wash your hands afterwards or just not careful, you can infect yourself. For cattle and sheep, they become infected by eating those cysts in the wild, in the soil. And then we can also, so these for cattle and sheep, they do go into the muscle. So we can actually get from undercooked cattle or sheep meat. So the symptoms of it are either asymptomatic, right? So it's not a big deal for most people, asymptomatic or mild. However, it becomes an issue because this guy does cross the placenta. So it does in the fetus. And also for the immunocompromised, you can have severe issues such as central nervous system disease. This fun fact, so there's been some work on Toxoplasma that has been very interesting. And because it does have a predilection to go to the central nervous system and cause encephalitis, for people who are not having this most severe disease, but maybe you're asymptomatic or mild, it has this way of manipulating behavior. And so the fun fact here is that mice who are infected with Toxoplasma become less fearful of cats. So usually mice are scared of cat urine, but if they're infected with Toxoplasma, they will actually be very curious about the cat urine, or in some cases, I even heard someone say they're aroused by cat urine smell. And so they're going to hang around that cat urine, and then that is where the cats go, right? And so they are going to be more likely to be eaten by cats than a mouse that, is scared of cat urine. And because of this behavioral change, someone looked into humans and they did find some behavioral changes with Toxoplasma gondii. And there's a sex difference between men and women with their behaviors. And I'll let you guys look that up because it's kind of a fun read to hear about what Toxoplasma gondii has done to people. And that crazy cat lady thing might be some truth to that. So in terms of the mother and fetus, it can pass through the placenta. So a pregnant woman should never handle cat litter, right? So never do that. And 33% if it can pass, if a woman doesn't get infected during pregnancy, 33% chance that it can pass. This is a chance that it can pass on to fetus. If it does that, the fetus, the children may suffer impaired vision, cognitive issues, again, central nervous system. This is a baby born with hydrocephalus, which is more fluid. The cerebrospinal fluid is unable to drain from the brain, and so it causes swelling of the brain. And this expansion of the skull is only possible for newborns or very young babies because the skull is not fully formed. There's still areas where there's connective tissue between the plates of bone. And so that connective tissue is able to allow that fluid to build up and also to, basically have an increase in the head size. If hydrocephalus happened in an adult, you would not see the same enlargement of the cranium because our bones are fused. And so instead of having the expansion, it would basically crush our brain. It's actually better that the baby's skull is malleable and able to expand so that the pressure of the fluid inside is not going to crush their brain. All right, so that is it, you guys. So we looked at malaria and toxoplasmosis. I know that there's a lot more here that are very interesting, but we just don't have time to cover everything.